Hello guys, welcome to my YouTube channel. Don't forget to like and subscribe. In here, I want to tell you about how US health insurance works. Healthcare in the United States can be very expensive. A single doctor office visit may cost several $100 and an average 3-day hospital stay can run tens of thousands of dollars or even more, depending on the type of care provided. Most of us could not afford to pay such large sum if we get sick, especially since we don't know when we might become ill or injured or how much care we might need. Health insurance offers a way to reduce such costs to more reasonable amount. The way it typically works in that the consumer you pay at from premium to a health insurance company, and that payment allow you to share risks with lot of people enrolls who are making similar payment. Since the most people are healthy most of the time, the premium dollar paid to the insurance company can be used to cover the expense of the relatively small number of enrolled who get sick or are injured. Insurance company, as you can imagine, have studied this extensively, and their goal is to collect enough premium to cover medical costs the enroll. There are many different types of health insurance plan in the US, and many different rules and arrangements regarding care. There are three important questions you should ask when making a decision about the health insurance that will work best for you. The key question number one: where can I receive care? One way that health insurance plan control the cost is to influence access to provider. Providers include physicians, hospital, laboratories, pharmacy, and other entities. Many insurance company contract will specify network of provider that has agreed to supply service to plan enrolls at more favorable pricing. If a provider is not in a plan network, the insurance company may not pay for the service provided or may pay a small portion that it would for in network care. This means the enrolled who goes outside of the network for care may be required to pay much higher share of the cost. This is an important concept to understand, especially if you are not originally from the local Stanford area. If you have planned through a parent, for example, and that plan network is in your hometown, you may not be able to get the care you need in Stanford area, or you may incur much higher costs to get the care. Okay, question number two: what does the plan cover? One of the things healthcare reform has done in US under the Affordable Care Act is to introduce more standardization to insurance plan benefit. Before such standardization, the benefit offered varies drastically from the plan to plan. For example, some plans cover prescription, others did not. Now, plans in the US are required to offer a number of essential health benefits, which include emergency service, hospitalization, laboratory tests, maternity and newborn care, mental health and substance abuse treatment, outpatient care, or doctor and other service you receive outside of an hospital, then pediatric service, including dental and vision care, precision drug, preventive service, for example, some immunization and management of chronic disease. And the last is rehabilitation service. For our international population of students who might be considering coverage through a non-US based plan, asking for the question, what does the plan cover, is extremely important. And the third, how much will it cost? Understanding what insurance coverage costs is actually quite complicated. In our view, we talk about paying a premium to enroll in a plan. This is an upfront cost that is transparent. You know how much you pay. Unfortunately, for most plans, this is not the only cost associated with the care you receive. There is also typically cost when you access care. Such cost is captured as deductible, insurance, and or copay. See definitions below. And they represent the share you pay out of your own pocket when you receive care. As a general rule of the thumb, the more you pay in premium on upfront, the less you pay when you access care. The less you pay in premium, the more you will pay when you access care. The question for our students is pay or a larger share now or pay a larger share later. Either way, you will pay the cost for care you receive. We have taken the approach that it is better to pay a larger share in upfront premium to minimize as much as possible costs that are included at the time of the service. The reason for our thinking is that we don't want any barrier to care, such as a high copay at the time of service, to discourage students from getting care. We want students to access medical care whenever it's needed. There are some important insurance terms and concepts. Out of pocket expense, meaning the term out of pocket cost and or cost sharing refer to the portion of your medical expense you are responsible for paying when you actually receive healthcare. The monthly premium you pay for care is separate from this cost. Then annual deductible. The annual deductible is amount you pay each plan year before the insurance company starts paying its share of the cost. If the deductible is $2,000, then you would responsible to paying the first $1,000 in healthcare you receive each year, after which the insurance company would start paying each year. Then the copayment or copay. The copay is a fixed upfront amount you pay each time you receive care when that care is subject to a copay. For example, a copay of $30 might be applicable for a doctor visit, after which the insurance company pick up the rest. Plans with higher premiums generally have lower copay and vice versa. Plans that do not have copay typically use other method or cost sharing. Then coinsurance. Coinsurance is a percentage of the cost of your medical care. For an MRI that costs $100,000, you may pay 20% or $200. Your insurance company will pay the other 80% or $800. Plans with higher premium typically have less co-insurance. That's all. Thank you.